Hello, good evening, Dr. Juan Granada, sir. I'm Dr. Srinivas Kumar here. Can you hear us?
How are you doing? I can hear you very well.
Thank you for taking time out.
This coffee.
Thank you, sir, for joining out in spite of your all health hiccups and other things. We're fortunate to have you. And Ajay is also a lot of troubles. He is still come here. So that shows the commitment and the love and affection you people have towards us. And thank you for again joining on this day also, because many of us are here, including me, who are wanting to hear what is new in the coming up in CRF and in general research as front, because a lot of good work needs to be done. That's why I requested to deliver this talk in this newer innovations intervention session at the end. Over to you, Dr. Granada.
It's a great pleasure to be with you. I'm sorry I could not, make it this year due to some health issues, but it is my pleasure and my privilege to be here with you guys today. What I'm going to try to do, instead of actually putting a big list of devices and technologies, which sometimes is actually boring, what I wanted to do is kind of like take you to a journey, explaining the main changes that I see in the field according to the needs, requirements, and challenges that we have today in clinical practice. I don't have any conflicts related to this talk. Innovation, in a way, actually follows the needs, requirements, and challenges of clinical practice. And I believe that the changes that we're having right now in the clinical practice will determine the future of interventional cardiology. Our field is not really on the prevention business. Our field is actually more on the therapeutic business, getting actually to treat late the disease states. And now, more than actually ever, is extremely important the cost effectiveness of therapeutic intervention. So that's why a lot of innovation right now is not really based on new devices or technologies that are treating specific diseases, but actually more about improvement on procedural outcomes, procedural recovery, and early hospital discharge. So a lot of innovation in the near future, will be essentially focused more on processes than devices per se. That's the reason why minimally invasive technologies will continue to dominate. Devices actually need to get smarter, smaller, and actually more predictable, aiming to actually not only improve clinical outcomes, but actually also send the patient home earlier. So the innovation drivers for catheter-based technologies essentially rely on making the devices smaller, the procedures actually simpler. That's why robotics and the integration of imaging is so important, and the standardization of the procedures. And I really think this last one will be a big deal actually in the future. Catheter-based techniques are already available to treat all major cardiovascular conditions. I mean, you actually saw the previous talk, and it's actually interesting to say that in the cardiovascular field, there is pretty much a device for every single cardiac pathology that we face right now. It's not that we have curative technologies, but actually we do have therapies for virtually every single cardiac condition right now. So this will continue to be like this, and actually technologies will continue to evolve. And right now we have this new field that we call interventional heart failure, in which multiple devices have been now tested and right now clinically evaluated to treat heart failure in multiple presentations. It's an example of those in which a successful first-in-human study was recently presented, in which a shunt was put from the LA to the coronary sinus, with a very nice preliminary results presented at THT this year. And there is actually also a lot of work in the development of smart pumps to treat actually multiple heart failure conditions and actually improve the clinical condition of these patients, either to be treated at the hospital or also to be treated as an outpatient. One of the big things that will determine the future of our field is essentially the evolution of cardiac imaging. I mean, we are cardiac imaging dependent for planning, for guidance, and for outcome assessment. And this is where artificial intelligence is really disrupting, our field first. And the introduction of new imaging technologies that are simple to use and interpret will serve as the expansion platform for catheter-based technologies. I really think is the evolution of imaging is what is going to really help us to go into the next level of procedures. And there's a lot of knowledge gathered from actually the regular IT world, the digital world. And all these algorithms for classification, segmentation, translation that you guys see on Instagram and Facebook and TikTok and all these algorithms have been already adopted and actually brought into cardiovascular imaging algorithms. And right now, we have the possibility, there are like at least 3 or 4 companies doing fast automatic segmentation of echocardiograms. And right now, the possibility of reading echoes automatically without the need of a human is now more possible than ever. Which is actually important about this is that allows the standardization of the reading and actually also the standardization across hospitals and actually across core labs, if you will. And this is already happening, the possibility of essentially providing more access also to sites in which echocardiographers actually do not exist or they're not available. So this is actually fascinating to see how this imaging evolution is actually happening right now. There are also examples of the automatic reading and analysis of CT angiograms, in which not only the obstruction pattern is determined, but actually also, a smart FFR based on CT findings can also be done, and planning for the procedure can be provided to the operator. So I really think this is actually what the future is going to bring in the future, in which the planning of these procedures and diagnosis of coronary disease is going to be done more as an outpatient than in the cath lab. Also, there are examples right now in which AR and VR is being used in the cath lab to decrease, for example, sedation during interventional procedures. This is an example in which the patient is being essentially treated or actually put an AR glass, and essentially relaxation of the patient is actually done by using AR, VR technologies, decreasing sedation in patients that are high risk for this type of procedures, or the use of AR, VR to essentially get safe access, vascular access in patients by essentially extrapolating the patient's anatomy in front of you and being able to get access with this type of technology. So there is a tremendous evolution on imaging based on AI, AR, VR, and actually all the digital transformation that we have, right now. Procedural standardization is actually a big deal. I mean, if you see the procedures that we do, people actually do it according to their own skills, training, and available technologies. And I really think that if we want to, at some point, improve outcomes across the board in actually different countries, different regions, different hospitals, standardization is extremely important. And catheter-based interventions introduces certain levels of variability in procedural flow and outcomes, and robotic platforms provide an opportunity to really simplify these interventional techniques, standardize procedural flow, and possibly actually improve clinical outcomes. As it happened in other industries, in manufacturing, in aviation, I really think the robotization of our field could potentially really help us to achieve that. An important component on innovation right now in terms of funding and interest is in the objective of keeping the patient at home and monitoring performance once the patient is actually released. And there are a lot of technologies trying to work on understanding what are the potential predictors of failure once the patient is released at home. This is an example, of an app that is meant to actually be used for surgical or interventional procedures, in which the app automatically can really tell you the amount of blood loss the patient had and the potential risk of actually discharging a patient that lost a lot of blood during the procedure. This is something that is difficult to quantify in a way, and it's actually interesting to see how automatically the app can tell you, listen, this patient lost a lot of blood, this patient is a high-risk patient that perhaps needs to be monitor more aggressively. And this is the type of actually apps and opportunities that the future is going to bring to us in the clinic. Also, microsensors and the possibility to monitor the patients at home is something that is already a reality. This is actually a sensor we implanted at Skirball in the experimental setting, as you can actually see here. And we precisely put the sensors in the anterior annulus of the mitral valve. And you can actually see how we can really monitor real time the left atrial, pressure. These sensors can be placed virtually anywhere and provide the possibility in the future to monitor, hemodynamic if they're implanted alone or in combination with different devices, of the hemodynamics of the patient, real time, anywhere, everywhere. And I really think this is going to be transformational in the future as well. Another important thing is actually the fact that there is variability in humans, not only on the genetic side of things, but actually also in the physiologic and demographic side of things. And predicting the therapeutic response, what is being called personalized medicine of therapeutic interventions, is something that is really important, rapidly growing. Again, through the use of machine learning, artificial intelligence, right now there are multiple companies and organizations trying to gather what is called big data and being able to essentially predict, the demographic and clinical characteristics that can really, serve to predict outcomes once an intervention is performed. And the personalized approach to therapy success is something that is gaining a lot of traction. And that's why there is the big explosion of essentially devices that can capture data in multiple shapes and form. So identifying the non-responder phenotype to therapeutic interventions is something that is capturing the attention of a lot of the big companies, especially the technology companies. And that's why you see Apple, Google, and other companies getting into this space, because the importance of essentially getting this data and being able to predict outcomes in these patients in the future. Finally, one big thing, and this is something that really happens not only in India, Latin America, also in the US, is the limited access to care. And this is actually a very important component, in our ecosystem, and actually also an important component that needs to be filled and actually addressed by innovation. This is actually a map of the US that actually shows access of stroke centers to the general population. And if you actually see in the US, only 20% of the US population can access a stroke center capable of endovascular thrombectomy to remove a clot in 15 minutes or less by ambulance. And only 30% of Americans can access a thrombectomy-equipped center in 30 minutes. This is the US, and you actually see the limitation of access to care to stroke centers in the US. That is the reason right now there is a lot of interest in actually what is called tele-interventions or telehealth, being able to essentially do remote interventions by qualified physicians in complex procedures. This was the first description of transcontinental telestenting actually done by a physician, as you can see here on the East Coast, on an interventional suite that was placed on the West Coast, 3,000 miles apart. And with the new introduction of 5G broadband, it is actually now possible. There's a lot of work and a lot of interest and a lot of plans about developing these telestenting programs for conditions that are critical, such as massive stroke got a lot of challenges and a lot of regulations, but this is actually something that could potentially fill that gap in areas in which the access to sophisticated technologies and physicians is actually really limited. So the future of interventional cardiology, I would summarize it as follows. I believe the drivers of innovation in our field are rapidly changing. Unfortunately, operational and financial efficiencies are becoming important metrics in the scale of value of emerging technologies. Digitalization of catheter-based technologies have the potential to achieve these goals by simplifying and standardizing procedures, enhancing remote monitoring. In the future, the new model for healthcare delivery will be personalized, decentralized, and data-driven. But for the new generation, the people that just started this field, my message is that there has never been a better time to be an interventional cardiologist. I really think the options will be multiple, not only because the diversification of our field in multiple specialties, but actually also because the potential for innovation in multiple areas that have not been explored, in the past. So I really think the future is bright and long, and the possibilities are multiple. Again, thank you again for the invitation. I hope you enjoyed this talk, and I'm open to any questions if you have any.
Thank you, Dr. Juan, for the excellent talk. Here in our Medtronic session, we had a VR utilization to show the latest small micro pacemaker catheter insertion. They have put it is very impressive, where you can see, learn yourself, and many such things are coming up innovatively. Way you showed it very well, and how we can also get influenced by various things coming up. You covered it very well, more than anything. We, in spite of all troubles, you were there for us. Any questions, Dr. Ajay? Is there any comments from the chair?
No, Juan, thanks so much as always. Every time you give the talk, I learn something new, and again, feel better. Really appreciate your logging in twice for the two talks, and hope to see you soon.
The stroke interventions also, we had just a talk, and then we had
a talk on stroke interventions,
and we also had that newer innovative procedure of tennis venous ASD closure. I think live cases generally have some preference. He's calling. I think if you can continue.
Live case.
Yeah, live case, then you come back. After 10 minutes of presentation, we'll come to Bhagirath's
No, that sounds great. Well, Juan, thanks so much. We're going to live case number 34. So here we go.
All right. Okay.
Thank you. Thank you, sir.
Bye-bye.
Bye.
Okay, bye.